Hi, everybody. Happy Thursday. It's a great lead up to a Memorial Weekend. Hope you're all having a wonderful day. We're going to go ahead and get started here in just a minute. I wanted to invite you to let us know where you're viewing from today. We're always curious to see where our audience is attending from. You can send a little chat window or utilize the question pane. We'd love to know what you're doing today and how you're enjoying your day. So if you've ever been to a Your Best You webinar before, you'll know a little bit about us. But for our newcomers, just a little bit about our practice. We're actually celebrating our 67th year serving the Charlotte community. We're really proud of that. And we have currently 6 nationally and internationally acclaimed plastic surgeons from across the world. You've probably seen them on a lot of our local media channels. You'll see them on Fox 46, and they're all over Charlotte doing really great things. And we're actually the only plastic surgery group to ever win a Bob Award. So we're pretty proud of that, and we have a lot of top doctors and best plastic surgeons under our roof. So welcome again to our Your Best You webinar series. We do this every month and we cover a broad range of topics. Sometimes it's surgical, sometimes not, and today you're going to see a mixture. We're going to be talking about how to avoid looking done. We've got Dr. Jack Shire with us today. So a little bit about what you're going to experience today. You're going to see photos of patients who've had a little bit of work. Some of them have had a lot done, but regardless, they don't appear done. And we're going to explain to you what those procedures are that they've had and show you how you can have the same type of result, subtly turning back the clock on aging, but without it being obvious to all of your friends and family. We're going to give you tips on how to prevent yourself from becoming a victim of obvious plastic surgery. You don't want to see someone walking down the street and say, oh my goodness, what have you done? So we're going to empower you on how to look great at any age, know how to do your research, where to start, and what questions to ask. Dr. Jack Shire is originally from Camden, South Carolina, and he joined the practice last year. He did his undergraduate at the University of Virginia, which is actually a family tradition for him. He has a few other family members that also attended that school. He went to medical school at the Medical University of South Carolina in Charleston, and he did both his general and plastic surgery residencies at the University of Texas Southwestern, which is right now the #1 ranked plastic surgery training program in the U.S. He also did an aesthetic surgery fellowship in New York at the Manhattan Eye, Ear, and Throat Hospital. So he has a wealth of expertise. And you will love listening to what he has to say today. We're going to go ahead and begin the webinar. I want to point out to you that we will be sending you a recording. It will come in a follow-up email, usually the day after the broadcast. And you can ask a question at any time during the broadcast. So just go over to your little question pane, send us a note. We will have a live Q&A at the end. We will address all of your questions. And if we don't get time to answer your specific question, Dr. Shire will follow up in an email after the broadcast. All right, I'm going to go ahead and hand it over to Dr. Shire, and I'll be back with you at the end.
So I want to start off by saying thanks for having me. I'm going to talk to you today about 5 tips for not looking done with plastic surgery. So good plastic surgery is all about plausible deniability. You want to look like yourself, you want to look refreshed, but you don't want your friends saying, who's your surgeon, or what did you have done, or trying to guess what you've had done. And lastly, you don't want to try to look like someone else, or you don't want the goal to be to look like someone else. You want to look like yourself. As we age, the face changes in pretty predictable ways, and this is due to changing of the fat compartments in our face, as well as changes in our bony skeleton. And some of the areas that patients often ask about is the hollowing of the temples, and that's that area just lateral to your eyebrow between your hairline. And over time, that area can lose some fullness and can even have a little bit of concavity, and that's normal. We see that with aging all the time. The upper lids sometimes will hang a little lower than they did previously, along with the brows. You have some excess skin up there. Along with below the eyes, you can get some fullness there that wasn't there before, and you get that tired appearance where your lid and your cheek used to always be almost like a harmonious blending. You've lost that, and we see that a lot as we age, and that's fairly common. And that sort of goes along with the cheek flattening as well. We also see deepening of the nasolabial folds, and that's that crease that runs from the corner of your nose down to the corner of your mouth. And the marionette lines can deepen as well, and that's from the corner of your mouth down to your chin area. You also lose some of that jawline definition, and you can get something called jowling, and that's basically a little bit of extra tissue along your cheek and your chin region. The last thing that people often ask about is that area beneath their chin that goes to their neck, and we call that platysmal banding, where you can have sort of some lines, especially when you animate or when you sort of flex your neck muscles. You can see some of the lines that go from your cheek down to your chin, and also some excess skin there. So people lose some of that angularness or that definition in that area. So good surgery, like we talked about, is all about plausible deniability. And here's a patient who looks very youthful, looks like herself, and you may say, what has she had done? Has she had anything at all? And what did she look like before, if so? So you can see she's definitely has maintained a look that appears like herself prior to any procedure. And all she's had is some Botox and some dermal fillers. And you can see those lines of 11 between her eyebrows, that sort of that furrowed area. The Botox has really softened that up. Also, the area lateral to her eyes, the crow's feet area, we sort of call it, where you sort of get that from squinting, and over time, those lines can deepen. Botox helps with that quite a bit and sort of softens that area up. And then the nasolabial folds, like we talked about earlier, you know, that deepening that goes from your nose area down to the corner of your mouth, just some dermal fillers injected really softened that up for her and basically improved and gave her a more rejuvenated appearance. And lastly, you can take a look at the marionette lines, and those lines that go from basically the corner of your mouth down to your chin area. Some dermal filler there really improved that and softened it up. But the whole point of the slide is she hasn't had that much done. She still maintains a look like herself. She doesn't look like she's been overdone or has that sort of plastic look. Here's another patient who has a very rejuvenated appearance, and you may ask yourself, what does she have done, if anything, and are there any telltale signs of procedures, if at all? So here's her before and afters, and you can see she's had some surgery done. And the first thing that I'd mention is she looks very much like herself on the left, but a very rejuvenated version of it, a well rested and more youthful appearance. And you can see she's had surgical stuff done as opposed to the last patient. But the whole point of it is both these patients, when done correctly, you can look like yourself and at the same time not have that sort of plastic or done look. And for this patient, just to go into further detail, she has those lines that are above her brow, and that's from raising her brow over time or involuntarily raising her brow. And with a brow lift, she doesn't have to do that all the time. So that helps ameliorate those lines in that area. And as we talked about, that skin of the upper eyelid and the lower eyelid over time changes. And with a blepharoplasty, which is a fancy name for an eyelid lift, with the upper and the lower, you can see she's gotten rid of that excess skin of the upper lid, and she's able to really blend that lid-cheek junction from her lower lid into her cheek. That gives you that more youthful, harmonious appearance. Likewise, she was interested in addressing the jowling, and that you see that area along her jawline where you don't have that clean sort of straight line that she did when she was probably younger, and that banding like we talked about before that goes from the chin down into the neck. So a face and a neck lift can really address that. And the whole point of the face and neck lift is resuspension, not just of the skin, but the tissues beneath it. And when done properly, it gives you a very youthful appearance without giving you that lateral sweep or that pull too tight look. Because in the end of the day, the facelift and the neck lift is all about repositioning the tissues beneath the skin, not exactly just pulling the skin tight. And that's one of the things that you can see when you have that done look, is when that is ignored and basically the skin is just pulled tight without addressing the tissues beneath it. And that can give you a sort of that bizarre or that plastic look. Here's another example of a patient who had some jowling and that banding beneath her chin. And with a simple procedure, that can be greatly improved. And you can see she still looks like herself. She doesn't have a very unnatural look. So it can also give you a very well-rested, renewed kind of look. So the first rule is don't bargain hunt on aesthetic procedures. Botox parties are great and they're very popular these days, and I have nothing against them, but the one thing caveat I would add is be wary of doing them with uncredentialed practitioners. And what that means is if you do attend Botox parties, which I said are fine, we recommend going to ones with practitioners that at least you know of or been recommended or have some background that you're familiar with. Going to random ones with people who who don't really know of or know what their results could be can lead to results that are not intended or results that you don't want. And the whole point of it is the safety is of the utmost importance. And this is just another example of the progression of looking like yourself to having a look that's sort of artificial. On the left of your screen, you can see a patient who has a very youthful, very normal appearing face. And then in the middle, with just a little bit of enhancement, she still maintains her natural look. It doesn't look artificial, doesn't look different. But you can see on the very far right of the screen, as soon as you start over-treating certain areas of her face and ignoring other areas, is when you start to get that bizarre look. And that, for instance, you can see she already has good brow elevation in her or you would say her non-simulated photos. And on the very far right, you can see her brows seem over elevated, her cheeks seem too full, her lips look too large for her face. And that's the whole point of what we talked about. You want to achieve a natural appearance. When you start over addressing areas or over correcting areas without maintaining proportions of the face as a whole, you achieve that artificial appearance, that plastic and that done look. So the take home point is, when you're doing these areas, you want to make sure that you achieve proportional results to the rest of your face. And here we just want to hit home examples of improper Botox placement. Here on the slide, you can see several examples of low set brows, and that's normal. I'm not saying these patients have had Botox, but it's important to take into account the location of the brow when injecting the forehead. If Botox is placed improperly or too low in these patients, it can further drop the brow, creating a distressing result for the patient. And likewise, improperly placed product can result in several different abnormalities. And one is a quizzical brow, where basically the Botox has been injected immediately or in the middle of the brow area and laterally on both sides, but for some reason or another, one brow laterally is not as affected as the other one. So you sort of have this asymmetry where one brow is raised as opposed to the other one. And it gives you sort of this quizzical look where you have an elevation that's asymmetric. Now, the good news is that's fixable with just some Botox to the other side, but at the same time, that's a tell of having a Botox injection. There's also something called the Spock eyebrow, which is essentially the middle portion of the eyebrow area is injected or over-injected, ignoring the lateral portion. So when you animate or when you move your eyebrows, nothing moves except the area that's lateral that moves up and outward, and that gives you a very odd appearance, and most patients don't like that. A very rare complication is a dropped upper lid, and that can happen when Botox is placed improperly, or even if it's placed properly, it just migrates to an area it's not supposed to, and the lid can hang lower on that side that's affected. And the good news is that's temporary and resolved once Botox does. The Botox typically lasts about 3 months, and there are medications you can give in the interim period that can help with stimulating that lid to rise a little bit. Lastly, Botox is great for injecting in the upper lip when you're trying to address those very fine lines. However, if it's overdone, it can lead to a flattening of the upper lip and a sort of an asymmetric smile that most patients find a little bit distressing. So this slide, the basic take-home point of this is that there are different routes of getting your training. Plastic surgeons, facial plastic surgeons, dermatologists, and injectors for that matter have all gone through rigorous training and have been given the surgical skills or non-surgical skills for that matter, depending on what you're doing, to practice safely and achieve predictable results. There's others out there that have gone different routes, and I think it's important to find someone who's done the proper training so you can achieve safe, predictable, as well as attainable results. And so that's sort of a slide sort of comparing the differences between on the left of your screen, what I talked about earlier, people who've done a certain type of training and others on the right side of the screen. So rule number 2 is know your treatment options. Do your research. You can do this by asking close friends about their experience and ask for feedback, whether it be positive or negative. You can do some research online. There's several trusted websites out there that patients give real feedback, and there's real patients in these communities as well. One of them is Real Self. The whole point is there's so much information out there, but knowing which information to trust is key. So start with ones that promote board certification or board eligibility and transparency of results. I recommend understanding the investment you're making. If you research breast augmentation and found the typical price ranges between $5,000 and $7,500, but you see an ad for one that's $2,500, that should raise a red flag for you. You know, you get what you pay for, so you want to make sure that you get a quality result. You should never cut corners on the quality, or else you may be investing in something that may cost you more down the line to fix or undo what has been done. And likely, lastly, I would recommend knowing about the downtime and side effects that may occur from any surgery or procedure you may have. So you're able to make a smart decision about your care. And also, you want to make sure that if complication does arise, you're with someone who's been well trained, who can deal with that complication and help you navigate those waters. And here's an example. This is just a web page Photoshop of RealSelf, and that's that website I was telling you about earlier. And RealSelf is a community of patients and physicians sharing their experiences and various aesthetic topics and procedures on the internet. And you can see real patient photos, read their stories in their own words, and ask questions and read real physician responses. It's a great resource when preparing for your own consultation with your surgeon or your injector. And also, when you're informed about your care, like we talked about before, we need to know what options you have and what to expect and what kind of results you can achieve. It helps you get a better idea and makes you more informed, and it makes the whole process less stressful. Yeah, it also allows you to take a more active role in the decision-making process as well. So rule number 3, balances everything, and this sort of harkens back to what we talked about earlier. When evaluating the face, we typically divide it horizontally into the rule of thirds, where basically the face is divided into an upper face, mid face, and lower face. And vertically, we divide it into fifths, and that helps us to make sure that we achieve proportional results to all the other areas, so we don't overaddress one area without addressing the others. We want to make sure we don't get that quilted appearance where one area it looks overdone and the other areas have not been corrected in a proper or balancing manner. And this is just sort of an illustration of those rule of thirds and the fifths right there. So here we see some examples of some well-known people, and this is just to illustrate that overcorrection can lead to that artificial result that we're trying to avoid here. Some of these people you can see had a very natural appearing, results initially or before they had any surgery, and then afterwards, over augmentation or over injection or over fillers can lead to that sort of artificial appearance where it doesn't look proportional to the rest of their face. We have, the eyes are normal size. We have these very large cheeks or these very large lips, and the face itself should look almost like an upside down egg for most females. That's sort of the ideal proportion. But when you sort of have it very wide in the mid face as opposed to a narrow lower face and then the narrow upper face, that's when you start having sort of a very disharmonious look and something that you can just sort of look at and say, this doesn't look natural. And this goes for the body too. When you sort of over accentuate certain areas, you can achieve a result that does not look proportional to the rest of your body. And this is another person that's well known. You can see this is an example of overfilling or over volumization. I don't know what procedures, if any, he's had done, but I can tell you that his face definitely looks changed from his younger photo, and it does appear that overall his facial proportions have changed from when he was younger to where he is now. And some of that is sort of that unbalanced, that disharmonious look like we talked about earlier. And here is an example of a well-known person who had a beautiful face, got some fillers. You can see, like we talked about, has a very full cheek, very full lips, and almost disproportionately so. And then over time, it sounds as though she had her fillers dissolved and then had them correctly placed in a more proportional manner. You can see she looks much more like herself as opposed to where she does in the middle picture. So this sort of goes back to what we were talking about earlier. More is not always better. You want to make sure that it's properly placed if you're going to get any kind of augmentation, whether it be filler, fat, and that is proportional to the rest of your face. When you start getting out of your proportionalities is when you start getting that real plastic look, at least for fillers. Here's a patient that was unhappy with the appearance of her jowls as well as her upper lids. And if you look at the overall skin appearance, she had some decreases and some aging spots, and her eyelids sort of hung a little bit lower with extra skin. And you can see just by how fixing her neck and her jowls would not address her overall concerns. So with several procedures, including a face and neck lift, you can see her jowls are much improved, as well as that banding underneath her chin area. And these procedures for her eyelid lifts or the blepharoplasty have really blended her lid cheek junction much better, and also taking care of some of the excess skin of her upper lids. And also, you can see that the laser treatment has really given her a much more rejuvenated appearance and helped with those very fine lines and those sunspots and that discoloration that you get from the sun exposure and aging as well. And the whole point of this slide is basically she's had more than one thing done, but she still looks like herself. And the take-home point is, when done properly, you can achieve a very natural appearing result. And you can, like I said, the goal is to look rejuvenated, but not look like someone else, and not have your friends asking, what did you have done? Same thing with this patient. You know, she had some areas under her eye that she didn't like, made her feel like she was tired. And with a simple procedure, she can have that area, that fat removed, and it gives a much better blending of the lid cheek junction, and gives a more balanced appearance to her face, and helps with the concern that she had earlier. Likewise, we talked about each person needs to be evaluated individually, so she doesn't need anything else. She has otherwise a very harmonious appearance, and that's why each patient needs to be evaluated individually, as opposed to just having a blanket set of procedures that you do on everybody. Here's another patient who's very young. She just wanted to increase her definition of her lips, and that could easily be achieved with fillers, but at the same time, she's not overcorrected. She doesn't have that disproportionality where her lips look very large for the rest of her face, and she has a very natural look. So the whole point of this slide is basically to say, you can have these procedures done and at the same time achieve a look that looks like yourself. And this also, we want to do the procedures tailored to each patient, as opposed to just blanketly injecting patients with the same thing like you would do for every single patient. We don't do that. We basically want to evaluate as an individual and make sure you get the kind of result that you're looking for, at the same time make you look natural. So here is the rule number 4, is making sure you treat as an individual. And we sort of talked about this a little bit already, but we're going to go into greater depth and detail here. So men and women have different overall facial aesthetics, and if you apply female ideals to a male and vice versa, you can get a result that doesn't really fit your face, especially if you apply female ideals to a male. And here's an example of that overdone look, where basically you can look and say, hey, this doesn't look like themselves. And a couple things I'd point out can result in this. And one is that you can look at the brow. The brow position on a male usually resides along that rim. If you press on your rim, for guys at least, for the most part, that the brow sort of sits on the air, it sort of rides that rim. Now, if it's elevated above it, it can lead to sort of a surprised look or a very feminizing appearance. The other thing that's very feminizing, if done improperly, is lid surgery in males. And you can see, or for example, I guess a better way to put it is, in males, the lash line towards the upper eyelid crease, there's barely any show, not very much show in most males. Now, everyone's a little different, so we can always say there are exceptions. But if there is a lot of show, we call that your pretarsal area, that upper lid show. If you get a lot of it in guys, a little more show, it can lead to a very feminizing appearance, or almost it doesn't appeal very masculine. And this is an example of that right there, where you can see that something doesn't look right. And sometimes it's hard to place your finger on it, but once you start really closely looking at it, you can see, hey, that doesn't look right for a male right there. And this is just a slide showing the different aesthetics for males and females. And like we talked about earlier, the brows are shaped different, first of all, and they're in a different position. In the upper eyelids in males, there's not much show, whereas females, it's normal to have some show. The Faces overall are shaped differently as well. Guys have a more broad chin with an angular jawline, where females have that more of an inverted egg appearance that we talked about. And that sort of distinguishes a female face from a male face. And males in general, just a little more angular. So if you start over-injecting or really filling out the cheeks in males, or lifting their eyebrows too high, or giving them more pretarsal show, it can start really giving them a more feminized appearance. So rule number 5 is sort of deciding how you want to reveal it. And the whole point of this is, you can do different things. There's not a one-size-fits-all here. You can make small changes over time. That's what some patients need. They don't need big procedures, or they don't want big procedures, and that's totally fine. Sometimes there's patients who want more or need more. And the whole point is, when you do that, there are ways to help lessen the appearance of having something done. And some people will get their hair done sort of just to add a little bit more of a change. That, so the topic of the conversation is not always how do you look different, why do you look different. I mean, you can talk about different hairstyles, different haircuts. People sometimes will change their makeup, or they've had eyelid surgery. They'll sometimes, do lash extensions over time, or do, lattice, which helps grow your eyelashes. But it's up to each person how they want to reveal it. I will say that if you had some procedures done, you need to factor in some downtime. Depending on what type of procedure, it depends on how much downtime. But for facelifts or neck lifts, I usually say about 2 weeks before you really want to go out in public. And that's just for the bruising and swelling and whatnot to resolve. Here is an example of someone who is younger, that's well known, and even to this day still has a very youthful appearance and looks like herself. And I'm not saying that she's had anything done, but the whole point of the slide is, with maintenance over time and proper skin care and just basically taking care of yourself, you can age very gracefully and maintain a look that looks like yourself. And they say, a lot of it is great DNA, and that is true, but a lot of it also is taking care of your body and, basically making sure that you stay healthy. And for any person, small things over time add to great results in the long run. So that's the last thing I'd like to add. So it's been a pleasure talking to you, and I hope you got something from this talk. And if you have any questions, just go ahead and send them over and we'll get started.
Wonderful. Thank you, Dr. Shire. I loved those slides. It's so great to see people who've had just a little bit of change or a lot of change, and they still look like themselves. They just look like they've turned back the clock a little bit. So, well, let's go ahead and get into our live Q&A today. Again, you can send us those questions. If we don't have time to get to your specific question, we will follow up with you in a direct email. So the first question that we have is about maintenance. Is 20-something too young to start doing maintenance?
No, I think that's actually a pretty good age to really start thinking about it. In fact, we all, at least, I imagine a lot of people listening, we live in the Southeast, and summertime's coming around, and there's going to be a lot of sun exposure. And, growing up, we always were told to wear sunblock, but it doesn't really hit home how important that is until you really start aging. So I think just simple things like wearing sunblock, doing skincare, just stuff like that will help you age more gracefully and sort of help your skin maintain its appearance. There's patients coming in at all different types of ages, sometimes as early as their 20s, asking about Botox and fillers. And that's not all uncommon these days. And I do think that it is helpful for maintaining a youthful look. Is absolutely necessary. I wouldn't say that's the case. But I think overall skincare in general does help sort of stave off the signs or aging, or the signs of aging, and also gives you, it's fun too for the patients. They can get involved in their own care.
That's great. Our next question is, when is a facelift appropriate? I know recently in Hollywood, there's been a lot of talk about people saying that celebrities, believe it or not, have been having mini facelifts as early as their 40s to help look youthful. But as far as like a big facelift goes, when is that appropriate for an everyday person?
So that's a good question. What I'd say is basically it's very patient dependent. People age differently. Some patients, is they can maintain a very youthful look well into the later years. And some patients, for reasons that we don't quite know or understand, aren't able to maintain quite the same. But there's no perfect age for a facelift. I would say it sort of depends what you're trying to address, because there's some patients who have very youthful face, but have difficulty getting rid of sort of that area under their chin or that extra neck skin or that banding. And you, like we talked about earlier, you tailor your plan individually for each patient. So that patient may just need a neck lift, for example, or maybe just a neck lift to some fillers under the eyes, and that's it. Whereas there's some patients, that age group who may need a little bit more, and then you get into a little bit more of an age group, and they may need a more aggressive facelift. Now, I say aggressive, I don't mean overdone appearance, but I mean more of a dissection or more of a suspension. So I think there's no right age to start things. It basically depends on what you're trying to address and what your overall goals are for the patient and for the physician as well.
Absolutely. We have a question here. What are the different types of fillers? And there are a few. And where on the face are they primarily used?
So that's a good question. And there are several different types of fillers out there. The ones we use in our practice, for the most part, are hyaluronic acid based, which is a product that's produced naturally by your body. And now there are many different types of fillers, and there's just variations on hyaluronic acid. I mean, there's different cross-linking, and there's different ways that it's made. So some of them are more thick and some of them are more thin. So it depends what you're trying to achieve is where you inject them on the face. So if you, for instance, if you're trying to get more of a fullness of your cheek, you'd probably want to use a more thick hyaluronic acid filler. And you would basically inject that deeper also, because you don't want to get that palpability of those nodules. Now, if you want to augment your lips or give more fullness to your lips, use a real thin one there, because your lips are moving around a lot, so you don't want any clumping of that filler. So that's what I would sort of say is a blanket statement with hyaluronic acid fillers. And the other good thing is too, is those are dissolvable. So if you get a result you don't like, you can inject an enzyme that will help get rid of that filler. And so that makes them a little bit more reversible. And there's other ones that are calcium based. There's other ones that have a different type of substances in it. And those will probably last a little bit longer. But those are usually injected somewhat deeper into the face area.
Wonderful. Well, thank you, Dr. Shire. That is all the time we have for questions right now. But again, please send them in, and we will follow up with an email. We'll have Dr. Shire address those personally. So how you can keep in touch with us and experience future webinars and even see Dr. Shire in person to talk about your particular needs, you can call us, and all of our cosmetic consultations are free. So there's no harm in just coming and seeing what your particular goals are and how they can be addressed. You can always visit our website at charlotteplasticsurgery.com, where we have regular blogs, regular physician tips and tricks, a lot of information about board certification and the like. And you can also follow us on our social media channels, Facebook, Instagram. We do a lot of behind the scenes posts there. You'll hear a lot of feedback from our physicians and what's up and coming, what's new in the industry. So again, thank you from myself and Dr. Shire. We appreciate you spending part of your day with us today. We look forward to following up with your questions, and we will see you at our next Your Best You webinar. Have a great one.